Now we have the topic of syndrome of inappropriate secretion of ADH. In this excess, ADH is secreted from the posterior pituitary or maybe the ectopic. Increased ADH levels will cause more watery absorption and more natriuresis, which will lead to hyponatremia and volume expansion. In this case, edema is not seen because of natriuresis. Causes: neoplasm, lung, pancreas, prostate, lymphoma, leukemia, CNS disorders, stroke, trauma, infection. Infection, it will lead to meningitis. Pulmonary disorder, it includes pneumonia, tuberculosis. Medication. Medication, we have the mnemonic of Cardish. C is C for chemo, A for antidepressants such as SSRIs, R for recreational drugs, D for diuretics, I for inhibitors, ACE and ARBs, S for sulfonylurea drugs which will use in diabetes, and hormone desmopressin. We have another cause of postoperative state: anesthesia, pain or stress. Now we are discussing its pathophysiology. Basically, ADH, the hormone, causes increase in aquaporin 2 channels on collecting duct, which will reabsorb more water from collecting duct. Basically, there is a cycle runs in this syndrome. More ADH, we will start from here. More ADH secretion, which leads to increase in blood water and decrease in blood sodium levels, which will leads to more blood volume will go towards the heart, and it will heart will secrete ANP and BNP hormone to decrease the volume, which will which will lead to decrease in renin production. Also, increased blood volume, which causes increase in GFR, which will also results in decrease renin production. Decrease in renin production will cause decrease in angiotensin and aldosterone production, which will ultimately lead to natriuresis. Increase in water and sodium excretion from the kidneys, which will causes decreased blood volume. Decrease in blood volume ultimately triggers ADH. Then there will be again increase in ADH secretion, and which will cause increase in blood volume by increase in water reabsorption and decrease in sodium. This cycle continues and it will causes SIADH. There are two types or symptomatics based on acute and chronic. Acute will leads to brain swelling, and chronic will not leads to brain swelling or cerebral edema. In acute, there is sudden change in sodium levels. Osmotic water shifts, which will lead to increase intracellular fluid volume, because more water in sodium in circulation and less water in brain cells. So water follows sodium. As there is more sodium in the brain cells, water will move from circulation towards brain cells, which will leads to brain swelling and brain edema, which will causes lethargy, somnolence, weakness, seizure, coma or death. In chronic hyponatremia, cell adapts. The brain cell secretes its sodium in circulation and adapts, so there will be no swelling because water goes after sodium. The investigation which we do is hyponatremia, urine test. In urine we check hyponatremia. Sorry. In serum we will see hyponatremia, and in urine we will see concentrated urine, and plasma osmolality will be decreases. Serum uric acid will be decreased. Blood urea nitrogen and creatinine in plasma will also be decreased, and we will measure plasma and urine ADH level. Now we will move towards management. First of all, we will treat cause, which is causing increased ADH production. For asymptomatic patient, we will do first step of water restriction, then normal saline and loop diuretics. Then drugs includes lithium carbonate and demiclocycline, which inhibits lithium carbonate and demiclocycline inhibits ADH in kidney. For symptomatic patient, restrict water intake and isotonic saline. In severe cases, we also give hypertonic saline. Then there is the term central pontine demyelinosis. Myelinosis. In this case, there is more sodium in the circulation and less in the brain. In the central pontine demyelinosis, if we in this case, if we suddenly increase the sodium concentration too much, too rapidly, it will lead to more sodium in the circulation and less in the brain. So water follows the sodium. Water will move out of the brain cells and into circulation. The brain cell will shrink. It will cause central pontine demyelinosis.